Hello and good afternoon dear students. Today we will discuss about the Cushing syndrome. In this video we will discuss about the introduction, causes, clinical features, diagnosis and treatment plan of Cushing syndrome. So first of all, what is the introduction of Cushing syndrome? Introduction of Cushing syndrome. So if someone asks you that what is mean by the Cushing syndrome, you have to give a simple answer that Cushing syndrome, it is a condition in which we will see high level of cortisol. High level of cortisol basically shows the Cushing syndrome. First of all, we will discuss the normal production of the cortisol, that how the cortisol produced in our body. Just take an example that this is the hypothalamus, and from the hypothalamus, the name of the hormone is the corticotropin releasing hormone is produced. This hormone will come into the anterior pituitary, and from anterior pituitary, the other hormone produced, and the name of the hormone is the ACTH hormone. This ACTH hormone will give the message on our two adrenal glands which are present above the kidney. Just take an example that this is the adrenal gland which is a pyramidal in shape. This is also adrenal gland, and from the outer layer, the layer is known as a zona fasciculata. Zona fasciculata. ACTH hormone will give the message to the zona fasciculata, and then from the zona fasciculata, basically cortisol hormone is produced. So this is a normal mechanism of production of the cortisol hormone. Again, I'm going to revise this whole mechanism, which is a physiological mechanism that cortisol hormone is produced. First of all, there is a corticotropic releasing hormone which basically produced from the hypothalamus. This hormone from the hypothalamus will come into the anterior pituitary, and from the anterior pituitary, this hormone will produce the ACTH hormone. This ACTH hormone will come onto the two adrenal glands which are basically present above the kidney. Then from the adrenal gland, there is a layer in the outer layer. In the outer layer, there is a layer present, and the name of the layer is a zona fasciculata. The ACTH hormone will give the message in the zona fasciculata, and from the zona fasciculata, cortisol hormone is produced. So this is a normal mechanism of the production of the cortisol hormone. Now we will discuss that what are the main causes of high level of the cortisol. Now we will discuss. First of all, if someone asks you that what is the most common cause of Cushing syndrome, this is very important question and is asked many times in the exam. That most common cause of Cushing syndrome, you have to give the answer that the most common cause of Cushing syndrome is exogenous, or you have to give the it is a iatrogenic cause. First of all, we divide the causes of the Cushing syndrome in basically on the two types. One is a exogenous type and other one is a endogenous type. Exogenous type is mean that if someone is taking the steroids or the cortisol in a form of medicine. We know that nowadays in market a lot of steroids are used with the name of like dexamethasone, betamethasone, prednisone, and all these medicine which are mostly known as the steroids. These steroids have the cortisol. So if someone is taking the steroids from a long period of the time, it's mean that this person is taking the cortisol from long period of the time. It's mean that the person is going to increase the level of cortisol in the body. When the level of the cortisol will increase in the body, then this condition is known as a Cushing syndrome. And if someone asks you that a person is using the steroid from the last 6 months or the last 5 months, and now the patient have the clinical picture of Cushing syndrome, and examiner asks you that this type of the Cushing syndrome is known as a you have to give the answer that this type of the Cushing syndrome is known as a exogenous Cushing syndrome. Okay guys, now what is the exogenous Cushing syndrome? We will say exogenous Cushing syndrome mean iatrogenic cause. Now we will discuss in detail what are the endogenous cause. Just take an example that what are the normal mechanism of the production of cortisol. I already have discussed that the normal mechanism of production of the cortisol is like this, that if this is a hypothalamus, this is the anterior pituitary, this one is a posterior pituitary, and just think like this, and this is the adrenal gland on the both sides which are present in our body. From the adrenal gland, cortisol is produced. From here cortisol is produced, and from here corticotropic releasing hormone, from here anterior pituitary ACTH hormone is produced. Just guys take an example that if the tumor is present into the hypothalamus or into the anterior pituitary, then due to the presence of the tumor, the anterior pituitary, from the anterior pituitary ACTH hormone will produce in a huge amount or no? Automatically it will produce. Just take an example, if there is a tumor, due to the presence of the tumor, the hormones production will be the high. So it means the corticotropic releasing hormone will be high, ACTH hormone will be high, and when the ACTH hormone will give the maximum stimulation to the adrenal gland, it means that the adrenal gland will produce the cortisol hormone in a huge amount. And what is the name of the high level of the cortisol? It is the Cushing syndrome. And if someone asks you that what is the most common cause of Cushing syndrome endogenously, what you will say? You have to give the answer. It is known as a pituitary adenoma, mean the tumor in your brain. Okay guys, and other name of the Cushing syndrome into the pituitary adenoma, this is known as a Cushing disease, mean that if person have the high level of the cortisol and the cause is the tumor which is present into the brain, then this type of the Cushing syndrome, we will say that this is known as a Cushing disease. I hope so this will be the clear each and everything for you right now. Now just take an example that if a person have the tumor into the adrenal gland. Now you guys are adrenal gland adenoma, adrenal carcinoma, adrenal hyperplasia, yeah. So in all these conditions, we know that if the tumor is present into the adrenal gland, from the adrenal gland in a normal person, cortisol hormone is produced. So if there is a tumor into the adrenal gland, what is going to happen? If the tumor into the adrenal gland in a simple person, we will see that what we will see that the high level of the cortisol is going to produce, and when the high level of the cortisol is going to produce, then what we will see that this high level of the cortisol will basically inhibit what this will basically inhibit the ACTH hormone and also corticotropic releasing a hormone. So it's mean that if any person present to you with a tumor into the adrenal gland, when the tumor is present into the adrenal gland, it's mean that the cortisol level will be high, and this cortisol level which is elevated into our body, it will give the negative feedback mechanism to our brain. In result, it will basically inhibit the stimulation of corticotropin releasing hormone, and also ACTH hormone will be also low. Okay guys, so this was the second cause of the Cushing syndrome. Now we will discuss about this was the third cause of the Cushing syndrome. Now we will discuss the fourth one cause of the Cushing syndrome, which is also can lead to the Cushing syndrome. Fourth one cause of the Cushing syndrome, so guys, first of all, we have to understand about that in normal person, cortisol is basically produced from the adrenal gland. From where? Into the adrenal gland. With the help of which one? With the help of ACTH hormone. Now just take an example that if ACTH hormone start to produce not from pituitary, it start to produce from any other side of the pituitary gland. So this is known as the ectopic production. Yes, we know that in normal person, ACTH basically produced from where? Into the pituitary gland. So if ACTH hormone start to produce from where? Any other side, so we will say it is an ectopic production. In which condition we see the ectopic production? Guys, you have to give the answer. We will see the ectopic production in lung carcinoma, lung CA, medullary thyroid carcinoma, okay, carcinoid syndrome. So in these three conditions, what is going to happen? ACTH hormone is going to produce in enough amount. No, this ACTH hormone is not producing from the pituitary. This ACTH hormone is producing basically from the ectopic side. So this ACTH will start to produce cortisol hormone in an enough amount. When cortisol hormone will produce in an enough amount, so this type of the cortisol is known as a Cushing syndrome. And now we will say that all these symptoms, all the clinical pictures which we will see in a person due to high level of the ACTH and high level of the cortisol, these symptoms are known as a due to the paraneoplastic syndrome. We will say this condition is known as a paraneoplastic syndrome. Hope so you guys, each and everything should be clear for you. Anyone who has a question, you guys can ask. Okay, now we'll discuss a little bit more in detail. So if someone asks you that what are the causes of the Cushing syndrome, guys, if someone asks you that what is the most common cause of Cushing syndrome, what should be your answer? Number one, this is a question which is asked many times in the exam: exogenous cause or iatrogenic cause. Okay, it's mean medicine. In how many percent give the dexamethasone, betamethasone, in dexa, beta, all these type of the medicine, what is present in all these type of the medicine? Basically steroids are present. Okay, number two, what is the other cause? If there is a tumor into the pituitary gland, okay, then the level of the ACTH will be high. When the level of the ACTH will be high, at that time the level of cortisol will be also high, and the level of the cortisol can lead to the Cushing syndrome. And if a person have the tumor and this can lead to the Cushing syndrome, this type of the Cushing syndrome is known as a Cushing disease. So pituitary tumor, Other cause is a pituitary tumor. And when a person have the pituitary tumor, what we will say, this condition is known as Cushing disease. Okay, this was the second cause. Number third, guys, if a person have the tumor into the adrenal gland, just take an example that if a person have the tumor into the adrenal gland, it's mean that the person have the high level of the cortisol. When the person have the already high level of the cortisol, this will inhibit the lab production of the ACTH and CRH. So in a person who have a high level of cortisol, or who has a tumor into the adrenal gland, if we see the lab value in that person, we will see the low level of the ACTH, low level of the CRH, and a high level of the cortisol. So what this condition is known as the Cushing syndrome. High level of the cortisol is known as the Cushing syndrome. And other cause the adrenal adenoma, hyperplasia, or carcinoma. Okay, that's number fourth. Number fourth, we will say that if any person have the lung carcinoma, medullary thyroid carcinoma, or the Cushing syndrome, in this type of the carcinoma, there's high chances of production of the ACTH from these type of the cancers. And now the ACTH is not producing from the pituitary gland. This production is known as ectopic production. And if we see the clinical picture of the patient, this is known as a paraneoplastic syndrome. We'll say paraneoplastic syndrome. Okay, guys, or ectopic production. Now I'm going to make it very clear, guys. Very clear, and this is very important. This is very important point for you to understand if the examiner asks you a question. Okay, first of all, we divide these four causes of Cushing syndrome into further two types. What are the two types? ACTH dependent Cushing syndrome. What are the ACTH dependent Cushing syndrome and ACTH independent Cushing syndrome? ACTH independent Cushing syndrome. Now you guys will give me the answer. Just take an example. What is mean by the ACTH dependent Cushing syndrome? Just remember that if a person has the Cushing syndrome and in that person ACTH level is also high and cortisol level is also high, so we will say that this condition is known as the ACTH dependent Cushing syndrome. But if any person present to us with a low level of ACTH and a high level of cortisol, then this condition is known as the ACTH independent Cushing syndrome. Okay, guys, just think. For example, if any person present to you who is taking the medicines from a long period of the time, doctor prescribed and any other person prescribed steroids from the last 6 months. Now he is using the steroid from the last 6 months. In steroid, basically cortisol is present. Now he's taking the cortisol in the form of medicine. So this condition is on the exogenous. So if a person is taking the steroid from the outside of the body, it's mean that the production inside of the body will totally stop. We know that this person have the high level of the cortisol. This high level of the cortisol, what it will do? It will basically, if this is a corticotropic releasing hormone releasing from hypothalamus, then from the ACTH, from the anterior pituitary, adrenal gland, here is adrenal gland, cortisol. Okay, when already person have the high level of the cortisol in a form of medicine, this high level of the cortisol will basically inhibit the corticotropic releasing hormone and ACTH. So what we will see in the lab values, we will see low level of ACTH and high level of cortisol. And what the person is taking? Medicine. So this is a ACTH independent, because cortisol is increasing in a person but it's not dependent to ACTH. This condition is known as a ACTH independent Cushing syndrome. Okay, so in ACTH independent Cushing syndrome, one cause is exogenous. Okay, now we will discuss the other cause. Okay, guys, just take an example that if a person, well, this is a hypothalamus, this is a, okay guys, this is a corticotropic releasing hormone, this is a ACTH, and just take an example that we know that there's a two type of the adrenal gland are present, and from the adrenal gland, what is basically produced? Cortisol is produced. Okay, just here is the adrenal gland tumor is present, adrenal hyperplasia or the carcinoma. Due to cancer, cortisol level will be high or no? Cortisol level will be high. So this cortisol level which is increasing in our body are elevated. This will basically inhibit the ACTH hormone, and it will also inhibit the CRH hormone. When the ACTH hormone or CRH hormone will be inhibited, then this message toward the contralateral side, which at that side where is the adrenal gland is present, the other adrenal gland will receive the message no. Then what will happen to the contralateral adrenal gland? This adrenal gland will shrink in size. This is very important. Okay guys, one adrenal gland has a tumor. Due to the presence of the tumor, due to the hyperplasia of the tumor, adrenal gland, or due to the presence of the cancer or into the adrenal gland. Cortisol hormone is going to produce in enough amount. This cortisol hormone will basically inhibit the production of the ACTH and corticotropic releasing hormone. This ACTH hormone and corticotropic releasing hormone, when it will be inhibited, then the other adrenal gland or the contralateral side of the adrenal gland will not receive a message. When contralateral side of the adrenal gland will not receive a message, then what is going to happen? At that time, we will say that this adrenal gland will shrink in a size. Okay, guys. Now we are going to discuss in a little more detail. Now, ACTH independent Cushing syndrome. It's mean that in the lab value we will see low ACTH and high cortisol, and other cause, second one cause is a adrenal tumor. Okay, this is also clear. So now we will discuss that type of the Cushing syndrome in which ACTH is also high, cortisol is also high, which is also known as the ACTH dependent Cushing syndrome. Guys, for example, if a person have the pituitary adenoma, due to the pituitary adenoma, ACTH level will be high, cortisol level will be high, and this is a Cushing disease. Okay, mean that number one, ACTH Cushing syndrome is a Cushing disease when the presence of the tumor into the pituitary gland. Other one, for example, if anyone have the paraneoplastic syndrome, it's mean the ectopic production. When due to the ectopic production or the paraneoplastic syndrome, at that time the person have the high level of the ACTH receptor like peptides. These ACTH receptor like peptide which are increasing in our body, it will release the high amount of the cortisol. So what we will see, ACTH level will be the high, cortisol level will be the high. So these conditions are paraneoplastic syndrome. Okay, guys. So now will come the final result of the Cushing syndrome. What we are going right now, we are going to diagnose that how we diagnose the patient of the Cushing syndrome. Diagnosis in a patient of the Cushing syndrome. Guys, if what is the normal way to diagnose the patients of the Cushing syndrome? We know we divide the patients of the Cushing syndrome into further two other categories. One is a ACTH dependent, yes. Other is a ACTH independent. Okay, guys, independent. ACTH dependent Cushing syndrome, it means that ACTH level will be also high, cortisol level will be also high. ACTH independent means the ACTH level is a low, cortisol level is a high. Okay, the production of the high level of the ACTH and cortisol, we will say that this person is known as either the Cushing syndrome is due to the pituitary tumor or due to paraneoplastic syndrome. Okay, there are two major causes, but if a person have the high level of the cortisol and the low level of the ACTH, either the person is taking the cortisol in form of medicine, exogenous. Other one is maybe the adrenal gland tumor, presence of the adrenal tumor. Okay, guys. So these two things are clear, I hope so right now for you guys. Okay, now we'll discuss further. And just take an example that how we will diagnose the patient of a Cushing syndrome. First of all, for the diagnosis of the Cushing syndrome, we basically perform the three type of the test. That one test is a 24-hour urinary free cortisol test. First of all, what we will see? We will see the level of the cortisol. So if any person, the level of the cortisol is a high, so it means that the person has the Cushing syndrome. So we will say that if any person present to us with high level of the cortisol in the urine, this is a one test. Okay, what we will see? We will see that this is known as a Cushing syndrome patient. We will perform other test. What is other perform test? 1 mg dexamethasone suppression test. Don't worry, I will also read from the book. Okay, 1 milligram dexamethasone suppression test. Guys, just take an example. If we will give the dexamethasone from the outside of the body in the form of the medicine, this is also known as a cortisol. We are giving the cortisol from the outside of the body. So it's mean that the production of the ACTH, the production of the CRH, and the production of the cortisol should be low in a normal person. As I also discussed that one cause of the Cushing syndrome is the exogenous. In this type of the cause, what happened into the person? In this type of the cause, person is taking the in a form of the medicine from a long period of the time, and the ACTH level and CRH level is low. And we said that this type of the Cushing syndrome is the ACTH independent Cushing syndrome. So if we give the 1 milligram dexamethasone suppression test in normal person, if we are normal person, okay, what it will do? It will basically inhibit the ACTH, inhibit the CRH, and inhibit the cortisol. So if we give the 1 milligram dexamethasone suppression test, but the level of cortisol is not inhibited, the level of cortisol is high, it means the person have the Cushing syndrome. So this was the second test. Now we are going to perform the third test. In the third test, salivary cortisol level we check. Okay, salivary cortisol level we check. So just take an example that if any patient present to us with high level of the cortisol, it's 100% confirmed that the person is known as a Cushing syndrome. Now we have to find that where is the problem. Either the problem into the adrenal gland, or the problem into the pituitary, or the problem into the ectopic site, or the person is taking any type of the medicine. So we have to rule out, yes. So first of all, what we did, we checked the level of cortisol. If the level of cortisol, it basically shows the Cushing syndrome. So what we will do next, we will perform the next step of the ACTH level. Okay guys, if the level of ACTH is low, level of the cortisol is high, it's mean that this type of the Cushing syndrome is known as a ACTH independent Cushing syndrome. This type of the Cushing syndrome is known as a ACTH independent Cushing syndrome. Now guys, you have to tell me that what basically comes into the ACTH independent Cushing syndrome. I hope so everyone who's listening to me must know this, that ACTH independent Cushing syndrome basically include the one cause is either the person is taking from the outside of the body, which is the most common cause is exogenous. Okay, most common cause, very important question. Other one, what we'll say, either is a adrenal adenoma. Okay, for example, now we are going to perform other test. If we see a person in which ACTH level is high, okay, cortisol level is high, so this type of the patient is known as a ACTH dependent Cushing syndrome. ACTH dependent Cushing syndrome. Okay guys, so if someone is a ACTH dependent Cushing syndrome, then what we will see, that what are the most common causes of the ACTH dependent Cushing syndrome. Number one, maybe the tumor which is present into the pituitary gland. Okay, tumor which is present to the pituitary gland. So we will say Cushing disease. So if someone asks you that what is the most common cause of endogenously Cushing syndrome, most common cause endogenously, we will say it is a pituitary tumor. Number two, what other cause guys? Other cause of ACTH dependent is a maybe paraneoplastic. Okay, paraneoplastic syndrome. I hope so everything should be clear for you guys, crystal and clear. Now we will discuss another one. Just take an example. Exogenous cause, most common adrenal adenoma. So just take an example that if any person present to you with a low level of ACTH, high level of cortisol, yes, we said that this is known as ACTH independent Cushing syndrome, and there are the two major causes of ACTH independent Cushing syndrome. Either the person is taking exogenously, or there is a tumor present into the adrenal adenoma. Now how we can differentiate adrenal adenoma? One way of the differentiate, take the history of the patient. Take history of the patient. When you will take the history of the patient, he can say you, yeah, I am using the medicine from the last 6 months. And some patients mostly lie, they don't tell the exact things that the person is taking the medicine or no. Then what you will do? We will do the CT MRI of the abdomen. If we will do the CT MRI of the abdomen, then what we will see? We will see in one adrenal gland there is a tumor, and other side of the adrenal gland, which is the contralateral side, it is a shrinkage in size. Why shrink? Because message is not delivered from the corticotropic releasing hormone or ACTH hormone to the contralateral side. So that's other contralateral adrenal gland is a shrink. So I think so now your diagnosis 100% is correct, that if we do the CT MRI and if we see, oh, there is a presence of the adrenal tumor into the adrenal gland, we will show that this cause is due to the adrenal tumor. And if there is not any tumor, or we will not see the shrinkage of the contralateral side, like these type of the things, then we will say it is the exogenous cause. Okay guys, now we will come to what further in little bit more detail, that if any person have the high level of ACTH, high level of the cortisol, this is known as a ACTH dependent Cushing syndrome. Dependent Cushing syndrome. Okay guys, ACTH dependent Cushing syndrome. First of all, we know that there are the major two causes of ACTH dependent Cushing syndrome. Either the problem into the brain, yes, or there is a problem into the paraneoplastic syndrome, tumor into the lungs or thyroid or like this. So what we will do, we have to perform the MRI of the brain. If we do the MRI of the brain, what we will see? If we see that there is a tumor is present, then what we will say, the cause is due to the Cushing disease. The person have the Cushing syndrome due to the presence of the tumor into the brain. So if a person have no tumor into the brain, then what we will say? We will say that maybe there is another cause of the Cushing syndrome. Maybe there is a paraneoplastic syndrome. For this, we also perform different type of the test. One test, guys, First of all, we know that first what we have given, we have given the 1 milligram dexamethasone suppression suppression test. If we give the 1 milligram dexamethasone suppression test and the level of cortisol don't change, then what we will do, we will do the high dose dexamethasone suppression test. We will give the high dose dexamethasone of a suppression test. What is the main dose? 8 mg. We will give the 8 mg dexamethasone in a person, and after that, if the ACTH level drop, after that ACTH level is a low, so we will say that the problem where? The problem into the brain. But where is the problem? Problem into the brain. Okay guys, but after giving the high dose dexamethasone suppression test, if the level of ACTH don't drop, then what we will say? We will say the problem is due to paraneoplastic syndrome. Okay guys, other test which we also perform, CRH stimulation test. What we do into the CRH stimulation test? In CRH stimulation test, we will give the CRH in a huge amount. This CRH will basically stimulate the ACTH of your brain. This will stimulate the cortisol production high. So if after giving the CRH stimulation test, the ACTH level is high and cortisol level is also elevated, we will say that the problem into the brain, and this condition is a Cushing disease. But if after giving the high dose of the CRH stimulation test, ACTH and cortisol level don't change, it's mean that the cause is due to the paraneoplastic syndrome. Okay guys, maybe everything is clear right now for you. So if the cause is a paraneoplastic syndrome, then what we will do now? We will do the CT MRI chest to see the lung carcinoma, okay, and also abdomen. Other than this, what we do? We do the petrosal sinus CRH stimulation test sample. We also do the sampling to differentiate about among of this. So now we will discuss about the clinical features, the clinical feature of the patient with the Cushing syndrome. Guys, we should know that basically high level of the cortisol can increase the level of your blood glucose. When the blood glucose level will be the high, it can lead to the hyperglycemia. Okay, hyperglycemia, number one. Number two, we will say that high level of the cortisol, what it will do? High level of the cortisol will basically increase your blood pressure, which basically act on your blood vessels and your heart. When it will act on your blood vessel, it cause the vasoconstriction and the total peripheral resistance will increase, and it increases to the high blood pressure. So we can say that blood pressure will also high. So in patient with the Cushing syndrome, what we will see? Blood pressure high, blood glucose level is high. Okay guys, and other than that, high level of the cortisol basically inhibit the collagen synthesis. When the collagen synthesis will be inhibited, it can lead to the abdominal stria, okay, stretch marks. It will stria are the stretch marks, okay, and there will be the thin wrinkled skins, and obesity. You will see the obese guy. Okay guys, and other than that, what we will see? There is a buffalo hump. Okay guys, and moon-like face. Other than that, what we'll see? We will say the patient have the amenorrhea, muscle weakness, and skin ulcers. Skin ulcer are the bruises we can see in a patient of the Cushing syndrome. Now we will come to the treatment, that how we'll treat the patient. Guys, if the person have the tumor into the brain, then you have to perform the transsphenoidal surgery. Okay guys, number one. Number two, if a person have the tumor into the adrenal gland, then you also have to perform the surgery. Number two, perform the surgery. Number three, if a person have the ectopic site production, then you also have to perform the surgery. Number four, if a person is taking as a exogenously, then stop it not rapidly. If you will stop it rapidly, then it can lead to adrenal insufficiency. Okay, so if someone is taking the medication or the steroid from the long period of the time, you can never stop it immediately. If you will stop it immediately, it can lead to your adrenal insufficiency. So it can lead to even to the death. So you have to consult with your doctor, and the dose will be minimized with the interval of the time. Okay guys, so this was all about the treatment. Now we will go toward the USMLE step to CK, and we'll read from the USMLE step to CK. So guys, I tried my best to clear each and every your single concept. So first of all, if I discuss guys, elevated serum cortisol level and most frequent from the prolonged treatment with exogenous. What is the definition of the Cushing syndrome? Elevated cortisol level. And what is the most common cause? The exogenous corticosteroid. already have mentioned. Okay, the most common endogenous, what is Cushing disease? What is the Cushing disease? Means the production of the ACTH from your pituitary gland. So the most common endogenous cause is the hypersecretion of the ACTH from the pituitary adenoma, and this is a Cushing disease. Okay guys, other than that, we have discussed that other than that the causes are excess adrenal gland, maybe adrenal hyperplasia, maybe adrenal adenoma or the carcinoma. Okay, or the ectopic, which we say there's a paraneoplastic syndrome. Ectopic may be the tumor where into the carcinoma tumor, medullary thyroid carcinoma, small cell lung carcinoma. I think so I have discussed each and everything in full detail. Okay guys, now we'll come to what I will discuss diagnose, that how we diagnose this person, how we will diagnose. First of all, as mentioned that if we see any person with the clinical picture of the Cushing syndrome, and what are the clinical picture of the Cushing syndrome? Mean the person have the emotional disturbance, moon like face, osteoporosis, hypertension, buffalo hump, obesity, adrenal hyperplasia, adrenal tumor of the hyperplasia, wrinkles, striae, amenorrhea, muscle weakness, purpura, skin ulcer. I have discussed each and everything in full detail. Okay guys, so if person present to us with buffalo hump, with hypertension, hyperglycemia, striae, stretch marks like this, and we have to know that maybe the cause is due to the symptoms are due to the Cushing syndrome. First of all, what we have to do, we check the 24-hour urinary free cortisol level. Number 1 milligram dexamethasone suppression test. I also have discussed with 1 milligram dexamethasone suppression test there will be no change. Okay, will be we will see that cortisol level is not going to decrease. In normal person there should be change into the cortisol level. Okay, in normal person, if the level of the cortisol is changed, if the level of cortisol is low, then we will say the person have no Cushing syndrome, this is a normal person. Okay, or there is not mentioned about the saliva, you can write. Okay, suppression are normal, we will say no Cushing disease. Okay guys, other than that there's mentioned no suppression by 1 milligram confirmed with elevated urinary free cortisol. Mean we have given the 1 milligram, but the level of urinary free cortisol is not decreased, it's elevated already. We will say probably Cushing syndrome. Okay, now what we have to do, we measure the ACTH level. Why we are measuring the ACTH level? We are measuring the ACTH level because we want to differentiate either the cause is ACTH dependent or ACTH independent Cushing syndrome. So if the plasma ACTH is low or the suppressed, okay, it's mean that if a person, it's mean low level of ACTH, high level of cortisol. So this is known as ACTH independent Cushing syndrome. At ACTH independent Cushing syndrome, either two causes: exogenous, which is most common, or adrenal gland tumor. How we will differentiate adrenal gland tumor? CT MRI. Yes, and how is mentioned adrenal tumor confirmed CT MRI. Yo, 100% clear. I hope so. Now, plasma ACTH level is a high or not suppressed. ACTH dependent Cushing syndrome. How we will do MRI of the brain? If the tumor is a size, we will say there is a MRI of the brain will perform, and after that we see there is a tumor in the pituitary gland. We will say this is a pituitary adenoma. No adenoma, the small size. We will see if there is a tumor. Okay, we will say it is a Cushing disease. It is a Cushing disease. Okay, guys. If there is no tumor in the pituitary gland, we will say this is not a Cushing disease. There may be the paraneoplastic syndrome. And what we will perform? Will the petrosal CNS with CRS stimulation test. Guys, one thing remember in your mind, that with here if we want to differentiate ACTH dependent Cushing syndrome, mean pituitary gland tumor with paraneoplastic syndrome, we perform basically two tests. One is a high dose dexamethasone suppression, where we'll give the 8 mg. Other one is a CRS stimulation test. With 8 mg and CRS stimulation test, if the cortisol level is going to change, if level of cortisol change, it's mean the problem into the pituitary. If there is no change into the cortisol level, ACTH level, or anything else, we will say the problem into the paraneoplastic syndrome. Now just see, presence of a central peripheral ACTH gradient presence in change, ACT Cushing disease. No change, it's mean ectopic Cushing syndrome. Okay guys, now we are going to discuss what we will see into the Cushing disease. In the Cushing disease, we know that 24 urinary free cortisol level will be the high, salivary cortisol level will be the high, okay, ACTH level will be the high, and when we perform the dexamethasone suppression test with low dose, no change. With high dose, there will be the change. I have mentioned that in Cushing disease, when there will be the low level of the dexamethasone suppression test will perform, we will not see any type of the change. But when we will give the high dose dexamethasone suppression test, then there will be the production will be decreased. Okay guys, I hope so everything is clear. Now what is going to happen with the exogenous? In exogenous, cortisol level is a high, free cortisol is a high, ACTH is a low. Because high level of cortisol will basically inhibit the ACTH production. So here is a low ACTH. No, dexamethasone suppression is not going to change this one. Ectopic ACTH. In ectopic, this one is a high, urinary cortisol, salivary cortisol is a high, everybody is a high, and ACTH is also high. So if, just take an example, if I'm going to give the low dose or the high dose dexamethasone suppression test, it is going to change the level of ectopic production? No, the level will be the high, it's not going to decrease. Okay guys, so this was the main point of differentiate about the ectopic and the Cushing disease. So this is a high, okay, and if the person have the adrenal cortical hypersecretion, 24 is a high, cortisol is a high, ACTH will be low, because this is a ACTH independent Cushing syndrome. Okay guys, and other than that, here's I mentioned that what we will see the in a patient the Cushing syndrome, cataract, ulcers, skin bruises, hirsutism, okay, infection, because low immunity, high level of the cortisol will basically depress your immune system. That's why we'll see the recurrent episodes of the infection, necrosis, glucose urea, high level of the glucose, it can lead to the diabetes mellitus, and when there will be high level of the glucose, it will go into urine, it can lead to the glycosuria, it will also can lead to osteoporosis and immunosuppression and diabetes. Okay guys, everything is clear. If someone of you guys have a question, you can mail me on my email ID dr.zb776@gmail.com. Hope so everything is clear. I will see you next lecture. Okay, take care guys.